As the Premier said, unfortunately, I have to announce another individual has died of COVID-19. It's an individual as part of a resident of Northwood, part of that Northwood outbreak. And I, too, want to pass my sympathies and condolences along to the family. It's tragedy upon tragedy these days, but my heart goes to that family. Today we are announcing 16 new cases of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 737. We currently have 11 individuals in hospital, 3 of those in the ICU. We have 286 people now who can be considered to be recovered from their COVID-19 infection, and the total number of Nova Scotians who have been tested and are negative are 22,190. Along with that, we now have 10 licensed long-term care homes and unlicensed seniors facilities that have had cases of COVID-19, and the total number of residents involved amongst these 10 facilities is 128, and the number of staff is 62. Yesterday, I talked about the need for us to all to mourn and to remember families touched by the events from Sunday virtually. I've had some communication with the funeral service directors who were getting requests from families. I want to clarify that we can't, under the public health rules, funerals or memorial services can happen for immediate family. They can get together in numbers of 5 or less, as well as the rules around social distancing need to be respected. That is being communicated to funeral directors across the province, so they're aware of those rules and can work with immediate families to be able to hold in a limited way some funeral services and memorials. For the rest of us, and for larger extended families, as I said yesterday, unfortunately, we're going to have to ask people to remember and to mourn virtually, and we will find a time collectively when we're able to, due to COVID, to remember the events of Sunday in a way that can bring us more together physically. I also want to touch bases on some questions that have come to me and reminders around access to health care. Even though we have COVID-19 going on, we have significantly ramped down services in our hospitals and shifted many things in primary care to virtual care. We know that Nova Scotians of all ages may need care from the healthcare system for a range of reasons other than COVID. All those services are available. If you have a question about your health care and whether you need more immediate care, if you call 911, you will still get to speak to a nurse and go through their process. 811 is available. If you have an emergency, calling 911, you will be assessed and treated as appropriate. If you arrive at an emergency department, you will be treated. We also know that our family physicians and our primary care and our family practice nurses and nurse practitioners are all still available. Many of their services are being offered virtually, but many primary care needs can still be addressed through our existing your existing route into a primary care provider. It just may be that you do it from your home virtually, but please, we want the main message is that if you have other healthcare needs, I'm hearing stories of people about being afraid to go to hospital, feeling that the family doctor's office is closed. There may be a few circumstances the family doctor's office has been closed, but remember, if their office is closed, they may well be available virtually in a different way. So please continue to access health care as you normally would, understanding that there may be some challenges in some areas around increasing waits, but don't let your health care needs just sit unattended to. If you need help, pharmacists are also available for help as well. They're part of the health care team. I want to remind people as well that if you have COVID-related symptoms, that it's important that you access care in the appropriate way. So if you have fever, a new or worsening cough, a headache, sore throat or runny nose. If you have 2 or more of those, you may have COVID. So it's important that you access care by, if you're able to, go to do the 811 online assessment tool and then be directed from there. If you don't have that internet access, then calling 811, and then you'll be directed for testing if appropriate. It's really important that people who have symptoms that could be COVID go through the right way to get care, but we also want to make sure you're getting tested. It's important, a key part of our strategy, as I've said previously, we have 2 components. It's the strong public health measures and then aggressive and easy access to testing. We want to identify every single case of COVID-19 and have appropriate public health follow-up. But if people, for some reason, are not coming forward for testing, we won't know about you. So again, if you have any of the 2 or more of the symptoms that I listed, please contact 811 and go in and get tested. That's a critical part of our strategy as we continue to flatten the curve and minimize the impact of COVID in this province.